Laurence, we're here today to talk about dental implants, more in particular about the financial aspect of getting dental implants placed. These days, as you and I both know, dental implants have become the standard of care. It is a much better option these days to choose a dental implant for a patient rather than a bridge versus a partial denture or a denture. However, one of the hindrances for patients to choose that option is still the financial aspect that's involved with dental implant placement. So I thought it would be a good topic for us to talk and discuss the financial aspect that's involved with dental implant placement. So if you could talk a little bit more on that, that would be great.
Now that there are two separate and distinct parts to placing and restoring a dental implant. The first part is the surgical placement of the actual implant. In this area, that can average around $2,500. And sometimes you may need additional procedures. For instance, you may need an extraction or a bone graft before that procedure is done. But on average, you're looking at about $2,500. And once that part is done and the implant is successfully integrated into the surrounding bone, then you're looking at the actual restoration of the implant with what we call an abutment and a crown. An abutment is essentially it's like a screw or an appliance that goes into the implant that supports the crown. And we know what the crown is. The crown is the tooth structure, the tooth itself that replaces your natural tooth. That, in our area, costs about $1,500. So you may be looking at, maybe up around $4,000, close to $5,000. But what you have to keep in mind is that if you have insurance, that cost can be reduced by as much as a half, or it might even be a third. I mean, some patients pay $1,000 for both procedures if you have really good insurance. So, and there are also patient finance, and so that's the upper limit. It tends to actually be much less for a lot of people than they actually think before once they come into the office and you talk with us about your options and we make them more well informed. So it is a significant upfront cost, but in the end, it's an investment in your health. And you're going to keep that implant for the rest of your life. For most people, these implants, once we place them, they last 10, 15 years with 95% success rate. So it's an investment in your health, and it may be a bit much, but in comparison to the old standard of care where you put in a bridge or a denture, it's a much better investment, and cost in the long run is worth it.
Laurence, I think you brought up two very good points. Compared to about 10, 12 years ago, dental insurances are now more likely to cover dental implant placements, which has reduced the financial burden on the patient tremendously. And in addition, what you point out about the longevity of the dental implants these days, as you point out, we have data going back even 30 years and pointing out about 96, 97% success rate. So if you happen to be one of the patients that is missing a tooth and you're interested for us to take a look and evaluate your case and give you a better idea about your particular scenario, please give us a call.
And you can email us. Our email address is about the top of the screen.